Now quickly we're going to see the subtypes of Hodgkin lymphoma altogether to do the comparison before arriving to the complete evaluation of a patient with suspected Hodgkin lymphoma. Alright, so we have nodular sclerosing, lymphocyte rich, lymphocyte depleted, and mixed cellularity. So the nodular sclerosing is the only in which women present more often than men, and is the only in which we have the lacunes. So we have the red stem cells, like owl's eyes, and positive for CD30 and CD15 embedded in a lacune. Now here we will also see fibrosis and collagen bands. These cells would be like all together, clumped together with like nodules surrounded by fibrotic bands. This has an excellent prognostic, and there would be more or less some crosses of lymphocytes to one cross of red stem cells. So this makes a good prognosis. Could be associated with Epstein-Barr virus. And the lacune cells would be these red stem cells that are embedded in this lacune. Now the lymphocyte rich has the best prognosis, and this is because there is a lot of lymphocytes in comparison to the red stem cells, and in this specifically subtype, the red stem cells are called popcorn cells, and this presents usually in a less than 35-year-old man, and the lymphocyte depleted presents in elderly patients with disseminated disease, sometimes with HIV, and has the worst prognosis because there are very few lymphocytes, and so the ratio of red stem cells to lymphocytes is very high. Mixed cellularity contains eosinophils, histiocytes, plasma cells, and red stem cells. This also has an intermediate prognostic. We have like 3 crosses of lymphocytes and 4 crosses of red stem cells, so the ratio is almost 1. For that is intermediate. As much lymphocytes we have in comparison to the red stem cells, the prognosis is best. So the only type in which the woman has more prevalence than man is the nodular sclerosing, and the worst prognosis is with lymphocyte depleted, best prognosis with lymphocyte rich, and all could be associated with Epstein-Barr virus, but the most common would be mixed cellularity.